So you're ready. When did you run your race?
I ran on Thursday.
Thursday. How'd you do?
Oh, I'm sorry. This coming on?
There's a race coming up on Thursday.
Yeah.
Okay, cool. Let's get you an adjustment. Let's get your spine checked. Let's go face down. So you've been getting adjusted for about, what, 4 months now?
Yeah.
Maybe a little bit more? Okay, so as a chiropractor, we're looking for spinal alignment. It's so important to have proper spinal alignment, whether you have symptoms or not. And I know you don't have any symptoms. And it's all about making sure your spine is properly aligned so your body can perform at its utmost potential. There's a reason why Olympic athletes and professional athletes see chiropractors even if they don't have pain. So pain relief is not our objective. Okay, you're a little off on that left-hand side. I don't know if the camera could pick it up, but that's your pelvis on the left-hand side. Lift your right thigh straight up in the air. Put it down. I'm going to show you like this, straight up. Okay, good. Put it down. And now the opposite. Okay, a little harder on the left-hand side. Okay, so we're going to adjust this left side. So lay on this side of your body facing me. The side posture chiropractic adjustment, unique to chiropractors. So some physios do it as well, but not as good as chiropractors. Okay, so right here, I want you comfortable. You know, this is the move that a lot of people, if they tighten up, it makes it hard for me and hard for you, and I don't want to work that hard. So I want to make this easy, concise. Take a nice deep breath in, and I'll be quiet so maybe you can even hear that release. Let your air all the way out. Damn. Lovely audibles. Okay, let's go face down on your stomach once again. I want to recheck that we have that leg length discrepancy balanced again. There you go. That looks great. Cool. I'm going to come back again and lift this left thigh straight up. A little bit easier.
Yeah.
Okay, good. So it's little things like this that make the difference between winning and losing with athletes. Okay, cool. That's what we want. We want to see symmetry and balance. A lot of times patients, one side will be a lot harder. Chiropractically, that indicates that there's a lumbopelvic imbalance, which will go down to the knee, into the foot, could cause knee problems, could cause foot problems. So making sure your spine is properly aligned will not only help your body heal itself, but also you'll perform at its utmost potential. That's why elite level athletes see chiropractors, and it's not about pain, it's about performance. Take a nice deep breath in. Good, and let your air all the way out. Mid-thoracic needs to move down. That was great. I don't know if you can see this, but I'm distracting with the Cox table. This is helping to elongate the spine, makes the adjustment a hell of a lot more comfortable, and definitely gets that release that we're looking for. Okay, so we're going to use the Cox table, the headpiece, which is pretty awesome and pretty unique. Not many chiropractors have this in New York. It just allows me to open up this area before the adjustment. Get in here. Okay, now I'm going to adjust that. So let's lock this so you're more comfortable. Take a nice deep breath in and let your air all the way out. Nice, easy clunk. Beautiful. Breathe in and let your air all the way out. This is easier. Drop this. Good. Good. Yes. Okay, cool. Let's flip over the cervical adjustment. So a lot of patients, this is where they have a little bit of fear of their neck being snapped or adjusted. Very, very safe, but if this is not the way that you want to get adjusted as a patient, we have other ways. So we have instruments, activator, and dual-pronged instruments, but I find this to be a very comfortable move. And I'm very specific about this adjustment, so it's not a gross manipulation. We're just going to move C2. Drop this, drop, clunk, lovely. And get in there to the lower cervical. Drop this. Good. And take a nice deep breath in and let your air all the way out. Good. That's my version of the ring dinger there. Okay, cool. Now, runners, one of the most important things I like to check are the hip flexors or the iliopsoas. That active release technique is one of those awesome treatments that help balance the pelvis after that pelvic adjustment. So this is the hip flexor. As a runner, the iliopsoas is one of the strongest muscles in the body. We see it on a lot of people that do spin class. This muscle will get super tight. So I'm going to have you breathe in, and I'm going to have you let your air all the way out. I'm just going to follow you down. It's not a very comfortable move. You feel that right there. Now push your knee into my elbow. Just want to make sure I'm on it. That's the muscle we're looking for. Now straighten his leg nice and straight. Good, and bring it down. 1. Good, 2. So bend your knee again, bend, and straighten it. Good. So this is called an active release technique. You'll see a lot of Ironman competition getting active release. A lot of runners, elite level runners, get this done. This is a very, I wouldn't say comfortable move because it's not comfortable, but it really does help with lower back pain. I see it in a lot of runners, a lot of cyclers. Well, I definitely want to do it on both sides. So there we go, a little bit easier, not as uncomfortable. I'm going to come around to the other side now. Okay, bend this again. Okay, breathe in and let your air all the way out. I'm just going to follow you down. Okay, that's the hip flexor. Push your knee into my elbow. You feel that, huh? Okay, straighten that leg. Good. So what I've found, keep on doing that motion, actively moving it, and do that again. What I've found is it's usually one side that's always a lot tighter and a lot shorter. When you could balance these, lower back pain, glute pain, sciatica, all that seems to melt away. So again, this active release technique on the iliopsoas muscle. Not the most comfortable move, you can see by your face you're making, but when you're working with elite level athletes, even the littlest thing could throw them out of balance and cause them to lose. So this is the competitive edge that we're looking for. So we're going to double check our work. Good, perfectly balanced and ready for your race on Thursday. You could sit up.